Welcome to the Exercise and Freestyle Libre session. My name is Parth Narendran. I'm a consultant in Birmingham and I lead the type 1 diabetes service there. And there we provide a service for people on pumps and continuous glucose monitoring. I also sit on the Daphne Executive Board and I'm also the lead for Daphne at my site.
And I'm Rob Andrews. Like Parth, I'm a consultant. I work in Taunton. I have an expertise in type 1 and exercise, managing elite athletes who have type 1. I'm also Daphne trained to do insulin pumps and continuous glucose monitoring. What we're hoping to do over the next 22 minutes of this video is we're going to talk about what you need to think about before you exercise. We're then going to work on to the options that are available for managing glucose during exercise. Then talk about options that are available for managing glucose after exercise. And through the whole course of this talk, we're going to look at how Libre can help you manage your glucose levels before, during and after exercise. So starting with considering exercise, there are three things that you need to think about. And it's worth bearing in mind that across this course, we're going to use something called the rule of threes. That's something that we invented for one of the programs that we teach on called exercise education. So the three things you need to consider when you're exercising are: what exercise are you going to do? What time will you exercise? And what has your glucose level been in the last 24 hours?
And just to remind you that all the principles we're talking about are part of an education program we run called the Excarb education program.
So moving on to the three things. The three things you need to know about exercise are: what type of exercise are you doing? What will the intensity of the exercise will be? And how long will you exercise for? So the three exercises, and what we've done here is simply divide them into three types of exercise. The first one is aerobic exercise, and like the word, that is a type of exercise that you use air or oxygen. And examples are shown here, for example, cycling your bike or running. The second form of exercise is anaerobic exercise. And like the word says, that is exercise that is done without air or without oxygen. That tends to be explosive and lasts for about 2 minutes. And then the final form of exercise is flexibility exercise. That's there in order to help you become more flexible and generally is stretching or yoga. Interestingly, if you're going to get good at a sport, you need to have all three components of these. So if you want to be good at a sport, you have to be faster, stronger and more flexible.
And whilst we've split these sports into three different categories, bear in mind that some exercises can fit more than one category. So swimming, for example, you can either do a sprint swim, in which case there might be more of an anaerobic component, or you can do a long distance swim, which is more aerobic. And then remember, some sports will also have different components of exercise in them. So in football, for example, if you're playing centre forward, you're going to be much more sprinting, so much more of an anaerobic component. Whereas if you're more in defence, it's going to be more of an aerobic component.
So the reason for splitting these into these types of sports are that they actually have differing effects. So what you can see on this diagram is that if you do a flexibility exercise, on the whole what will happen is that your glucose will stay fairly steady. If you're doing an aerobic exercise, on the whole what will happen is your glucose will gradually drift down. And if you do an anaerobic exercise, an explosive exercise, lifting weights, then your blood sugars will tend to go up. If you're doing a combined exercise or a mixed exercise, such as a team event where you're doing both aerobic and anaerobic, your blood sugars can either go up, they can stay the same, or they can fall, depending on how much you're doing of those components.
So for example, if we went back to the game of football, someone who's playing centre forward, their sugar might rise. If you look at that bottom graph, they might be on the upward arrow, but someone who's in defence, they might be falling on that bottom arrow.
The next thing you need to know about the exercise is the intensity of the exercise. And what we mean by intensity is the power that you're having to put into the sport. As the intensity goes up, you'll use more carbohydrate and less fat. And the reason why that's important is if you're using more carbohydrate, then you'll find that you might have to give more carbohydrate in order to prevent your blood glucose falling.
So the reason that's important is for different purposes. So for someone who's trying to lose weight, it'll be more useful for them to do a low intensity exercise because it burns more fat. And in someone who's doing a high intensity exercise in the context of diabetes, you'd just be careful to make sure there's more carbs coming on board to ensure there's no hypoglycemia.
And then the final thing that you need to think about the exercise is how long you're going to do the exercise for. So as you can see in this graph, what we're showing you is where you're getting the fuel from, either muscle triglycerides, blood fats, blood glucose, or muscle glycogen. And as you go on time, you can see that actually it's the blood level of glucose and the blood levels of free fatty acids that become much, much more important.
So I guess what this graph tells us is that if we're exercising for less than half an hour, or up to half an hour or less, depending on the intensity of course, but up to half an hour, we're not drawing much energy out of the bloodstream. We're generally using what's in the muscle, and therefore it shouldn't affect your blood glucose levels. So now we're going to think about the sorts of things we need to think about for the effective time. So what we're thinking about is how much insulin do you have on board? And in terms of the bolus insulin, remember that'll peak at about 2 hours after, it'll be present for about 2 hours after a bolus. So if you're exercising within 2 hours of a meal, you're going to have quite a large amount of insulin on board, and we'll talk a bit about that in the next slide. The other thing we'd like you to think about is whether you're exercising in the morning or afternoon, and we'll explain why that's important as well shortly. So if we look at our insulin levels in someone with or without type 1 diabetes, our lowest insulin level is when we wake up in the morning. So that's often the safest time to exercise. Then our insulin levels, of course, peak with each meal, as shown in this graph. And then in between meals is when our insulin levels fall again. So that's the second safest time to exercise.
What does this mean practically? What this means practically is that you could try exercising first thing in the morning, and if you do that, you're unlikely to need carbohydrate. The other thing that it says to you is if you do exercise within 2 hours of eating, you're going to be at high risk of your blood sugars going, so you might have to actually take some carbohydrate.
And then why is the time of day important? Well, remember in the mornings, not only is our insulin level low, but also we're most insulin resistant in the mornings. So we're least likely to have a hypoglycemia at that time. The other advantage of exercising in the morning is that if you were to have a hypo, you're more likely to be awake at that time. Whereas if you exercise in the evening, you might be asleep, in which case you'll be less aware of a hypo.
So now moving on to thinking about the glucose levels, again, there are 3 things that you need to think about. The first one is, have you had a low blood sugar or hypo in the last 24 hours? Second thing is, what's happened to your glucose over the last hour prior to you thinking about doing exercise? And finally, what is your current glucose? So going to the hypoglycemia and exercise, there are 2 different types of hypoglycemia. The first one is the severe hypoglycemia. And what we mean in simple terms by severe hypoglycemia is that you've needed someone else's help to manage that low glucose. If that's happened, then you're at very, very high risk of having another low or hypoglycemic episode when you exercise. And what we'd say is you shouldn't really exercise within 24 hours of having one of those low blood sugars that's severe. The other type of low blood sugar is the one that you don't need help. So just a simple low blood sugar or hypoglycemic event that you don't need help. With this, you're at high risk of having another low blood sugar when you exercise, but not as high as if you've had a severe one. So you are able to exercise, but provided you take a few things into account. We would suggest not exercising alone, so don't go off and do a solo swim or do a solo run. Monitor your glucose more frequently and check your glucose overnight.
And just to reinforce the importance of not exercising if you've had a severe hypo in the last 24 hours. So in Rob's clinics, he's now had 9 people who've tried to run the marathon within 24 hours of a severe hypo. None of them have completed the marathon, and 3 of them have ended up in the intensive care unit. So it's really important that that you do not exercise within 24 hours of a severe hypo.
So the other thing you need to think about is the direction of glucose. So although you'll get a reading on your machine saying that it's 6 or it's 8, what you need to know is what's happened in the last 15 to 20 minutes to tell you what that means. Is the glucose falling or is it rising?
And of course that would make a difference. So in this slide the glucose values are broadly the same, but if you are starting with a value of 9.8 and going up, you might delay having to take carbohydrates during the exercise. But if you were at 8 and on the way down, you might want to take extra carbs at the start.
And to try and help you with that, what we've developed is this algorithm. This algorithm is used on our course that we teach patients, and we've just changed it slightly to add the information from the Libre. So what you can see is it tells you when you check your blood sugar, you look up within the box as to what you should do. So if your glucose is between 5.7 to 6.9, then you would take 15 grams of carbohydrate before starting to exercise. Then shown on the right of the slide is additional information that you would get from the Libre and how you would interpret this flow sheet. So if your blood sugars are less than 6 or more than 15, on your Libre, we would suggest that you go back to the old way of checking your blood sugar, of doing a finger prick test just to confirm that it's less than 6 or it's less than 15, because you're going to have some action. If you're in that range of 5.7 to 6.9, but one of the arrows is up, then that suggests that your blood sugar is going to slightly rise, it's on its way up. So we're saying you don't need to take that extra carb that's in that box. If you're in that same range and the blood sugar is actually falling, then that means that you're at increased risk of you going hypo during the event. So we're suggesting to you that you should take twice as much carb in the first 20 and 40 minutes of exercise. And finally, if it's between 7 and 9, although the algorithm at this point says you don't need to take anything, if the arrow is going down, we would suggest you do take 15 grams of carbohydrate to make sure that your glucose doesn't fall during exercise.
So now we've spent a bit of time talking about the physiology of exercise and some safety aspects. So now we're going to talk about some of the principles we can use to manage glucose around exercise. And here we're going to concentrate on the principles during exercise, and we use this mnemonic called ICE, and it stands for insulin, carbohydrates and exercise, because these are the 3 things that can be used to manage the glucose. So first, we'll start with insulin. And going back to our earlier figure, remember peak insulins after a bolus insulin following a meal generally lasts for about 2 hours. So if you're exercising within that 2-hour period, we'd ask you to halve the dose of insulin as a starting principle. Now, if you think about it, during exercise, glucose is coming out of the liver into the bloodstream to replenish the muscles, and insulin prevents that. So if you were to take half the dose of insulin, it allows more glucose to come out of the liver to replenish the bloodstream and also to replenish the muscle. And this principle works, of course, for people who are on pumps, as well as for people on MDI with their bolus insulin.
And an example of that is, say that you knew that you were going to exercise within an hour after having your lunch, and normally we would take 6 units of insulin for that lunch, then you would take 3 units and then go and exercise after your lunch.
Now, for the basal insulin, remember that it's often too late to change that around the time of exercise, because you'll have either taken it in the morning or the evening before the morning exercise. So for people on MDIs, there's not much we can change for most situations. However, for people on pumps, we can change it. And here we're suggesting a reduction by 50% of your basal insulin starting an hour before exercise, continuing at that 50% dose, and then back up to your usual level when exercise finishes.
So going back to that example, if you were having lunch at 1 o'clock and you knew you were going to exercise at 4 o'clock, what we'd say to you is that you take your normal bolus of insulin, and then at 3 o'clock, an hour before the exercise, you would change your background rate down by 50%, it would stay there for an hour, then stay there for the exercise and remain after the exercise, and then stop off the exercise. An alternative to changing the insulin is that you could take carbohydrate. And what we term this is Excarb, so that is exercise carb or extra carbohydrate for exercise. And again, a starting point that we would suggest, or a simple regime that we would suggest, is that you start with 60 grams of carbohydrate taken every hour. We don't want you to take all the 60 grams at the start, otherwise your blood sugars will start high and fall. What we want you to do is we want you to take it every 20 minutes. So we would suggest that you took some every 20 minutes. The advantage that you have with the Libra is that you can also make changes whilst you are exercising to make sure that your blood sugars don't fall. And this is another one of those algorithms that you can use. So what's shown on this algorithm is what to do at each glucose level depending on what the trend arrows are. So for example, if your blood sugar is between 5 and 6.1 and you have a trend going downwards, then we would suggest that you take 15 grams of carbohydrate. That's roughly 3 jelly babies. Similarly, if it's between 6.1 and 6.9 and you've got a trend going down or an arrow going down, we'd say that you take 8 grams of carbohydrate. This way you can adapt and make sure that your blood sugar stays steady during the sport.
And then the third approach, so we've talked about insulin, we've talked about carbohydrates, and the third approach is to use exercise itself. And you saw before that different exercises do different things for your blood glucose. So as an example here, we can switch between exercises to control our blood glucose. So during aerobic exercise, as you see here on the first panel, during a run or a bike ride, the blood glucose levels are going to fall. However, if someone switched the exercise, it would put the blood glucose up if they switched to anaerobic. So I have a patient, for example, who when he goes into the gym, if his blood glucose is high, he would start with aerobic exercise to bring the glucose down, and then he'd switch to anaerobic. However, if he walked into the gym and his glucose was a little low, he would start with anaerobic to push the glucose up, and then he'd finish off with aerobic exercise to bring the glucose down. And you can also use this intermittently. So here is someone who on a long run might see his glucose drop through the run, but if he were to put in little sprints in between that, then it's an efficient way of keeping the glucose stable.
And it's very, very powerful, this. It's not a very big sprint that you need to do, so you only need to sprint for 10 seconds. But recently I had a patient that actually rode the channel, didn't use carbohydrates, used this mechanism for propping up their glucose. The one thing you have to remember though is that you've done 2 forms of exercise. And if you think of exercise as a bit like going on a credit card, is that if you do 1 form of exercise, you've got to pay back once the credit card. If you do 2 forms of exercise, you've got to pay the credit card twice. So you're at more danger of the blood sugars falling after exercise. That takes us on nicely as to what you do after exercise. Again, there are 3 ways to manage glucose after exercise. And again, we use that mnemonic that we used before, ICE. So ICE is there to prevent you having injury. So you can make changes to the insulin, make changes to carbohydrate, or make changes to exercise. So starting with insulin, as Parth mentioned, we all have a profile of insulin, starting with a low insulin in the morning, then having peaks with each meal time, and then your insulin falling over the evening. What happens to an individual who doesn't have type 1 diabetes after exercise is that they become more sensitive to insulin. Because they become more sensitive to insulin, they produce less insulin because it's able to do the work, and they have lower levels of actually insulin post doing exercise. Patients with type 1 diabetes also become more sensitive to insulin, so we have to try and mimic that post exercise. And one simple way of doing that is to do what we call the 50-50-20 rule. And what that means is that you do a 50% reduction of your normal bolus that you would take for the 2 meals after exercise. You do a 50% reduction of your normal correction, and you do a 20% reduction of your normal evening background. Particularly if you've done exercise after 4 p.m. in the evening, over 2 hours of exercise, or some form of high intensity training at any time during the day. If you were on the normal taking background insulin by injections, then you would just reduce that by 20%. If you're on a pump, then we'd ask you to put a temporary basal rate down by 20% for 6 hours from when you've gone to bed.
And this, on the pen, this advice applies to people on standard basals. Well, the ultra long-acting basals, obviously they have their advantages, but we found that with some patients that this, by the time the change is made, by the time the effect comes into place, it's a little bit too late. So in these situations, other approaches such as taking extra carbs will have to be used. And then moving on then, so we've talked about changing insulin after exercise, and now we're going to look at using carbs after exercise. And there's three things really. Firstly, in people who do lots of exercise, we've just got to make sure that the daily carbohydrate requirement is being ensured. And it's very common that this is not happening. So just make sure the right amount of carbs is going in for the standard daily requirement. Then on top of that is, do they need some extra carbs or extra nutrition for recovery? And then do they need some extra carbs when they go to bed? So firstly, for recovery, we would say that the recovery food is needed if it's been over 60 minutes of moderate intensity exercise or over half an hour of intensive exercise. We should think about some recovery food. And here we're thinking of food as a ratio of 4 carbs to 1 protein. And the protein, of course, is needed for muscle repair and muscle growth. And the carbohydrates is needed for glycogen replacement in the liver and in muscle.
And for an example as to how much you should use, what we're saying is you should use 1 gram per kilogram per hour of exercise of carbohydrate and 0.2 grams per kilogram of protein. So if you were 70 kilograms, you take 70 grams of carbohydrate and 14 grams of protein.
For bedtime snack, we'd say think about it if there's a concern about hypoglycemia, and particularly in two conditions. One is if there've been a late exercise, so after 4 p.m., and the other is if there's been a long duration of exercise, so over 2 hours.
And then the final thing that you can use is exercise to manage your glucose post-exercise. So exercise can help manage the glucose in 2 ways. One, it can help lower high glucoses when you finish the main exercise you were doing. And the other thing that we know is that the more exercise you do, the more per week, the more sensitive you become and easier it is to manage your glucose. So for example, if you've finished your exercise, say you had done a five-a-side football tournament, then you might find your blood sugars are very high. Rather than correcting with insulin, what you could do is do one of these exercises that's shown on this diagram that tend to lower glucose, such as a brisk walk or jogging. And what that would do would be bring down the actual glucose level and would mean that you don't have to take the extra insulin and be at risk of low blood sugar. And roughly, you need to do about 10 minutes of exercise to move your glucose by about 2.
So just to summarize then, our learning objectives are, what do you need to think about before you exercise? What exercise are you doing? What time are you doing it? And what's your previous and prevailing glucose? Then the other thing we're asking you to think about is, what are the options available for managing your glucose during exercise? So we're talking about insulin, both basal and bolus. We're talking about carbohydrates. And we're talking about using different forms of exercise to manage your glucose. And we're also talking about what are the options available for managing glucose after exercise. And of course here it's back to ice as well. So in terms of reducing your insulin, the 50-50-20 rule, extra carbs, both for recovery and as a bedtime snack, and also exercise itself to manage your glucose. And also we've touched on how the Libra can help manage your glucose around before, during and after exercise, both for looking at your prevailing glucose and looking at the trends. And what we've done here is given you some basic starting advice, which we think is safe starting advice, and more advanced advice can be obtained off our website, www.extod.org. Thank you.